السلام عليكم ورحمة الله وبركاته. مرحبا بكم جميعا. Today, inshallah, we will try to cover some important general terms for skin pathology. Firstly, we will start actually by very few important points about normal skin anatomy. The skin consists of three layers: the epiderm, the superficial layer, that is cellular layer, keratinocyte layer, non-keratinocyte cell layer. We have derm, that consists of connective tissue, blood vessels, and nerves. We have the fatty tissue, the subcutaneous tissue that act as a cushion against mechanical trauma to the skin. Structure of the epiderm: we have five layers in the epiderm. From downward above, we have the stratum basale, the basal layer, which contain the actively dividing keratinocyte stem cell for degeneration of the other cells layer. Also, it contains melanocyte. And we have the stratum spinosum, also called brachial cell layer, that contains cells which have characteristic cytoplasmic processes. And we have stratum granulosum, which contains basophilic granule, stratum lucidum, and stratum corneum. Stratum corneum contains the mature keratinocyte. What do we mean by mature keratinocyte? Means the cell, the keratinocyte, when it reaches to this layer, it will lose its nucleus and the organelles, and it will become filled with keratin. Okay, the superficial layer of stratum corneum contain dead keratinocyte, which in continuous state of flaking off. The journey from stratum basale till the cell will reach to the mature keratinocyte and the flaking off takes about 60 days. 60 days. This picture illustrates the types of cells in the skin. We have the keratinocyte actively dividing in the basal cell layer. We have the melanocyte in the basal cell layer also, stratum basale, while the Langerhans, it is antigen presenting cell, is present in the stratum spinosum layer. This picture shows the anatomy of the derm. It consists of papillary layer and reticular layer. Reticular layer consists of fibers and cutaneous plexus, while the papillary layer consists of dermal papillae and some papillary plexus. Also, component of the derm, we have the mast cell, we have the macrophage, we have the lymphocyte, the plasma cell, the neutrophil, and we have also the fibroblast, the most important cell that's responsible for production of collagen and elastin. And we have the fat cell, the capillary, and lastly the ground substance. The ground substance is made mainly from glycosaminoglycan. The ground substance is very important for supporting and holding water within the derm. This water is very important as it acts as shock absorbent factor. Now we will come to some pathological terms that are very important in dermatology. We have the macule and we have the patch. The macule and patch, both of them are discoloration in the skin. They are having a flat surface. The macule less than 1 centimeter in diameter, while the patch, it is more than 1 centimeter in diameter. The papule and the blacule, both of them are elevation in the skin area. The papule less than 1 centimeter in diameter, the blacule more than 1 centimeter in diameter. We have the nodule. Nodule, it is characteristic deep structure. It has a depth more than 1 centimeter in diameter, and the characteristic example is rheumatoid nodule on fingers. We have the pulla and we have the vesicle. The vesicle, it is characteristic accumulation of fluid inside a sac-like structure less than 1 centimeter in diameter, while pulla, sac-like structure filled with the fluid, but it is more than 1 centimeter in diameter. We have pustule, accumulation of pus, that is infected fluid. It's called pus. If it is accumulated in a sac less than 1 centimeter, it's called pustule. If it is in more than 1 centimeter, it's called abscess. Wheal, it is characteristic area of edema, vasodilatation, that characterize a patient with urticaria. It will take many hours to resolve. We have petechiae that are pinpoint bleeding. If it is less than 1 centimeter, it's called petechiae. If it is more than 1 centimeter, it's called ecchymosis. We have ulcer, erosion, and fissure. How we differentiate between these terms? The ulcer is sloughing area of the epiderm and part of the derm, while erosion only sloughing of the epiderm. the fissure, linear crack in epiderm and epiderm. The scale R means that excess number of keratinocytes are present. This is the characteristic appearance of scale. And lastly, thank you for your watching. The part 2, inshallah, we will continue the general terms for skin pathology.